If you're wondering about autism or ADHD, getting checked by a doctor is really important. Right now, NHS waiting lists are quite long, but there are things you can do while you wait. Today, we'll look at 3 screening tools that can help you understand yourself or your child better. Doctors have found that autism and ADHD often go together. In fact, many people show signs of both. Let's look at what tools you can use to learn more. The first tool we'll talk about is called the AQ10. This is a free test from the NHS that has 10 questions, takes about 5 minutes, looks at how you interact with others, checks your daily habits, and shows you how you handle change. When you take this test, you'll answer questions like, do you find it hard to make new friends? Or do you notice small details others miss? For checking ADHD signs in children, doctors use different tools. These are the Vanderbilt scale and the Conners scale. These work better for children because they look at things like how they behave at school, what teachers notice, how they handle homework, their everyday activities. Now, let's talk about what the scores mean. For the AQ10, a score of 6 or more means talk to your GP. Lower scores might still need checking. Any score matters if you're worried. The ADHD tests look at behaviour patterns, how often things happen, problems at school or home, and daily challenges. Before you take any test, here's what helps. Choose a quiet time. Have examples ready. Think about the last few months. Write down your concerns. You'll need to keep track of daily challenges, school or work problems, things that help, things that make it harder, any changes you notice. Let's talk about what happens after the test. You have 2 ways to get checked properly. Going through the NHS, start by seeing your GP. It's free. You might wait 6 to 24 months. However, you'll see a team of specialists. Now, if you're going private, you'll have to book straight away, wait 2 to 8 weeks, cost it between £500 to £2,000, and you'll see one main specialist. While you're waiting, there are lots of helpful things you can do, such as join support groups, use daily schedules, break big tasks into smaller ones, make quiet spaces at home or work, talk to teachers or employers. These groups can really help. Local NHS support services, online forums, parent groups, school support teams. If your test scores shows you might need help, you can book a GP appointment, write down your experiences, get feedback from school or work, look for local support, and keep a daily diary. Remember, these tests are just the first step. They help you understand what's going on, but they're not the same as getting checked by a doctor. You see, every person is different, and that's okay. These tools just help you start the conversation with your GP. Once you've done the test, here's what to do. Keep your results safe, write down any questions, make a GP appointment, take with someone with you if it helps, ask about next steps. Getting support early makes a big difference. Even while waiting for appointments, understanding yourself or your child better helps you find ways to make things easier. Let's finish with the most important things to remember. Tests help, but aren't final answers. Everyone is different. Support is available. It's okay to ask for help. Take one step at a time. Whether you're looking into this for yourself or someone you care about, you're taking a positive step forward. Use these tools to learn more, but always talk to your GP about your concerns. They're there to help guide you through the next steps.